The first therapy session is like our first boyfriend or our first girlfriend. We always remember it. And I can remember when I did my first therapy session over 20 years ago, and it was pretty scary going up the stairs. Actually, the first therapy session begins with a phone call. When you find the name of a therapist and you call her or him on the phone. During that time, we're going to talk about fees, we're going to talk about directions, we're going to make an appointment, and then have you come in. And I'd really like to get my clients in when they call within the first week, because it's already taken them so much courage to even make the phone call. Then when they come to my office, I greet them, I have them come into my office, and together we fill out the paperwork. I find that easier because I can read my own handwriting rather than read their handwriting if they filled it out in the lobby. And as I'm doing the intake, I'm talking about informed consent, and that covers the legal and ethical issues as a mandated reporter, when I'm required to call for child protective services, or if there's any unsafe issues, or if they're suicidal. But I do it in such a way that they feel comfortable. So we get the paperwork out of the way. And even as I'm doing their name and address, I'm also filling in other information. And it might seem like we go on a lot of tangents, but I think in the process of going on the tangents, they begin to feel really comfortable and relaxed. We set some goals for what we want to achieve in therapy, make the next appointment, and then they usually come back. And then for the second session, we'll start on a genogram. And a genogram is a family history. So we go into who's in your family now, who's your parents, and who's your grandparents. We gather up some of the skeletons in the closet. We reframe stuff so it's not so scary. And we begin to see how my past has impacted my present and when I want to make changes for my future.